Holidays can be really stressful, so stressful that the American Heart Association says most heart attack deaths happen the week between Christmas and New Year's.
And here we are. During that week, a new study also states that America's collective blood pressure has gone up thanks to the pandemic. The president of the American Heart Association, Dr. Lloyd Jones, is here to help us understand how we can stay healthy. Dr. Jones, thank you so much for being here with us. Most of the health talk for the past 2 years has focused, understandably, around COVID-19, but we do know about the heart attack risk, especially during this week in between Christmas and New Year's. But why do we see so many deaths from it during this week?
Well, you're exactly right. We know that this is the week where we see more heart attack deaths than any other week of the year. And I think, there are a number of contributors to that. Certainly, the holidays are a really busy, stressful time for so many of us. I think we get knocked off our routines, and that means maybe we're exercising less. Maybe we're forgetting to take our medications on the regular schedule. But also, I think too many of us don't really take time to relax during this time.
Always good advice. Take that moment for yourself. Now, a new study out of the Cleveland Clinic and Quest Diagnostics says our blood pressure average has risen during the pandemic, specifically between April and December 2020, but even more so among women. We have now been in this pandemic for 2 years. So how will this prolonged stress affect all of our hearts?
I think we've seen a number of data points like these blood pressure data that suggest that unfortunately we are losing control of some of the major risk factors for heart attack and stroke. And blood pressure is one of the most important of those risk factors. So we've seen data that from December of 2020, 45% of Americans were delaying or avoiding healthcare visits. And even this past summer, it was still 20% of Americans. What that means is people aren't getting in contact and knowing their numbers. And if you have something like diabetes or high blood pressure, it is so important to stay in contact with your healthcare team to make sure that those numbers are known and are under control.
What signs and symptoms can those at home look out for?
If you are having symptoms, please listen to your body. And the signs and symptoms of heart attacks are new or sudden onset of chest pressure or chest pain. Sometimes it's sudden onset of unexplained shortness of breath. And sometimes those symptoms could be a little bit more subtle. Sudden onset of neck discomfort or jaw pain, sometimes radiating to the arm. And in women, it can be even a little bit trickier. Sometimes it's just profound fatigue that has sudden onset. So please don't ignore these symptoms. Please get yourself to the hospital or call 911 if those symptoms are severe, because it could be a heart attack, and time is muscle. Time is heart muscle, and you need to get yourself seen so that we can take care of you.
Time is muscle. Such good advice to remember there. It is, though, of course, easy to get lost, right, in all of the holiday cheer, and either just simply not paying attention to symptoms or not wanting to make a big deal out of them during an important gathering. But as you say, it is so important to listen to your body, tell someone if something feels off, right?
No, that's exactly right. And, in addition to those heart attack symptoms, I want to make people aware of stroke symptoms. And we have a simple memory device. It's called FAST. So if you have facial drooping on one side, if you have arm or leg weakness on one side, or sudden onset of slurred speech, that means it's time to call 911. Those are symptoms of a stroke. So face drooping, arm weakness, slurred speech, time to call 911, FAST or FAST.
Important to remember that. Now, so many of us are experiencing a level of stress that we have never experienced before because of the holidays, the pandemic, nearly 2 years into it. You mentioned women, and heart disease is a leading cause of death for women in this country. And you said extreme fatigue could be a sign and symptom to look out for. So in the long-term care, what can we do for our hearts so we don't end up with permanent damage?
Yeah, really important. And let me say it clearly. Heart disease is the #1 cause of death for women in America and the #1 cause of death for men in America, by far, no contest. So people really need to think about taking care of their hearts. If you take medication for blood pressure, cholesterol, diabetes, please make sure you're taking it regularly, especially through the holidays, but of course, all the time. Eat less, eat smart, move more every day. That's a great way to take care of your heart. take time to relax. And especially this year, 2 extra things I'm going to add. Again, please be safe out there. Get yourself vaccinated. Avoid situations where you could come in contact with COVID-19, which is a terrible stress test for the heart and the whole vascular system. And in these times when we're seeing a lot of extra snow, particularly out west, please be careful shoveling snow. Snow shoveling is one of the most intense activities we can do, and it is a super stress test for your heart. You can overheat yourself, you're breathing cold air, but you're also exerting yourself pretty maximally. So please be careful when shoveling snow.
Dr. Jones, that is so relevant, as you said, as so much weather is hitting the West. So appreciate you being here with us because there's a lot going on, but we have to remember to take care of ourselves. Thank you so much, President of the American Heart Association, Dr. Donald Lloyd Jones. Thank you.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.